Okay, so when you talk about our hospital being at 91% capacity,
Right.
so we received a phone call from a community member. They received a letter from their organization saying that we were at 90% capacity, and they took that to mean we were 90% full of COVID patients.
Yeah.
So, you know, we just want to remind all of our attendees on this call, we are 91% full, but it's not all COVID patients.
Right. Yeah, again, we have 303 patients. Again, I'm excluding maternal child health. So the nursery, the NICU, mother, baby, labor and delivery, we would never try to put COVID patients there. So we always kind of leave them out of the mix. So we actually have more than 333 beds in the hospital, but if I just exclude maternal child health, I have 333 adult beds that technically would be available to take care of COVID patients. Of those 333 beds, 303 currently have patients in them, of which 68 are positive for COVID. So the vast majority of the patients that are in-house are in there for other reasons that they need to be hospitalized. Again, motor vehicle accidents, heart attacks, open heart surgery, neurosurgery, orthopedic surgery, you know, the normal things that we take care of all the time during non-COVID. We're glad to see those patients returning to us, because we were in the early days of the pandemic very fearful that they were staying away and sadly dying at home.
Right.
They were staying away from the emergency department, they were staying away from their physician offices, they were staying away from the hospital. I think they got to the point where they felt more safe coming back to the hospital, or said, I can't do this anymore. It's too risky. I've got to go to the hospital. So,
yeah. So what is our plan as all of our Kaweah Delta beds fill up?
So we definitely have surge contingency plans in place. So we have those 30 beds that are currently open in the medical center. We also, when I talk about our bed capacity, the 333, I'm only counting 19 of the beds that are on 3 West. So 3 West normally accommodates 30 patients, because in 11 of those beds we have double occupancy.
Okay.
So we generally have, 19 patients that are in single occupancy rooms and 11 rooms that are used for double occupancy. So we can house 30 patients. But right now, well, excuse me, I didn't say that right. We have 19 rooms on the unit, and 11 of the rooms we generally will put 2 patients in during normal times to allow us to accommodate up to 30. But during this pandemic, we brought them all down to just single rooms. So 19 patients only, 19 rooms, all negative pressure, all isolation. If push came to shove, we could take those 11 of those rooms and push them back to double occupancy. So that would give us another 11. Then I would go out to the West Campus. So out there we have a 45-bed acute rehabilitation unit. Right now there are, let's see, so of those 45 beds, 32 of them are empty. So unfortunately, the census of acute rehab, which tend to be a lot of patients that have suffered strokes or hip fractures, joint replacements, that are not ready to be discharged home, they really would benefit from some intense therapies, either physical, speech, or occupational therapy. Because of just shutting so much down in the acute medical center, that's impacted the acute rehab hospital as well, just that downstream referral business. So there are 45 beds, but they only have 13 patients right now. So that gives us another 32 beds that we potentially could open up. One of the things we could do is we could take surgical patients that upon their surgery being completed, instead of admitting them into the acute medical center, we would admit them out to the rehab hospital and take care of their post-acute recovery out there, which would then free up beds in the medical center for more COVID or non-COVID patients. We also have a 16-bed short stay skilled nursing unit on the West Campus. 5 of those beds are empty right now,
Okay.
So we could use that. Also our endoscopy unit in the hospital, where we do colonoscopies and bronchoscopies and other endoscopic procedures. We could shut that down and turn it into an inpatient unit. We've actually done that during crisis flu seasons. Sierra View Hospital took a conference room and turned it into an ICU. We've actually done that also in the past. A couple of years ago during the severe flu season, we took our Kaweah Wing conference room and we took the blue room in our basement and turned them both into patient care wards. So we could do that. The Porterville Development Center is now up and running as an alternative care site. The state owns it and operates it. It was designed to accommodate 150 patients, but they kind of only staffed it and stocked it for 50 patients initially, although they were trying to keep it down to 25. We understand they have somewhere between 16 and 20 patients right now. We've not sent a single patient there. They've all come from Sierra View Hospital in Porterville, and they primarily are focusing on patients that are essentially nursing home patients that are COVID positive, but can be transferred to that unit out there. So that's an alternative for us as well.
So I received an email yesterday from a community member, and he was in essence saying, "Are you panicking? Is the hospital okay?" And my response was, "We've been working on this for months. We've got a great team of people. We are not panicking. They have been preparing for this for several months, and I feel confident as an employee and as a community member that the hospital is stepping up to the plate to,
Absolutely, yeah.
you know."
I don't think panic is in our vocabulary. I don't know if it's just the way we're wired. I'd love to any of you to be able to come in and step into our command center, and it's like an orchestra, a fine-tuned orchestra. Just all of our leaders. We laugh, smile. We try to keep our wits about us and humor, but we're dealing with very serious issues. But everybody kind of knows their role, and they really kind of play off one another. We need to be calm. We need to be calm for our patients and our community and each other. I've spent the last 2 weeks, Jag Bath and I, rounding throughout the entire hospital. I'm handing out these really neat pins.
Cool pins.
Yeah.
I don't know if you can see it, but cool.
Healthcare Heroes 2020, and just people are so positive. Our staff smiling and staying positive, and so no, we're not panicking. I mean, we definitely get concerned. We're nervous at times. We hope that we're kind of hitting the peak right now, and that things will be stabilizing. We always get really nervous after a holiday, particularly the further the holiday is out, from the beginning of the pandemic, the more restless people get. The July 4th holiday was, 12 days ago? Kind of we're in the sweet spot of the incubation period that we would generally start to see. I think maybe that's why we're hitting close to 70 patients, is we are seeing the effects of a lot of those holiday gatherings. And but hopefully things kind of stabilize and ideally even begin to taper off.
Okay, thank you.